Do you experience chronic pain and struggle with simple movements on a daily basis? Do you miss being active and just want to enjoy your life again? Don't worry, because Catholic Health offers a team of orthopedic experts that can help you return to doing what you love. On today's show, we'll meet several orthopedic clinicians who are providing award-winning care to get you moving again, free of discomfort and pain. You will want to stay tuned because you're watching Stronger Together with Dr. Dave. Hello and welcome to Catholic Health, Stronger Together with Dr. Dave. Today we're talking about different orthopedic services at Catholic Health. My first guest is an orthopedic surgeon and the chief of joint replacement at St. Joseph Hospital, Dr. Eric Lepkowsky.
Thanks for having me. Happy to be here.
And I'm happy to have you. You are a busy guy. You are the head of joint replacement at St. Joseph's Hospital. First of all, tell us a little bit about St. Joseph's Hospital for the viewers.
So St. Joseph's Hospital is a small community hospital in Bethpage, New York. When I say small, it's referring to the number of beds. Doesn't mean we're not busy. We're actually one of the busier hospitals in the Catholic health system, despite our smaller relative size. Mm-hmm. We offer care across the spectrum. Obviously, for me, most importantly is the orthopedic care, but we also have cardiac, neurosurgery, general surgery, podiatry, plenty of other services across the board.
So you guys, you pack a big punch for such a small place.
That's the idea.
You know, it's amazing medicine has become so localized. We used to have to send patients into the city and to other states for procedures. Now they just want to stay home. So Bethpage is pretty close to just about everybody.
Yeah, and honestly I don't want to call them run-of-the-mill procedures because these things are very important to our patients. For more standard procedures, going to specialty hospitals sometimes has a downside where, God forbid there is some sort of issue, you need to see your doctor, more readily. That trip, an hour and a half, 2 hours to the city is a lot harder to do than the 5-minute trip down the road.
Absolutely. So tell us more about your program. So you're the head of joint replacement. What joints are we talking about?
So when we talk about joint replacements, while there's many of joints that can be replaced, the focus for programs like this and our program is hip replacements and knee replacements.
Got it. And do you have a tendency to do one or the other?
Just the way my practice is shaped out, I tend to do more knee replacements than hip replacements, about 2-to-1 ratio, but still do plenty of both.
Is that because more people have knee injuries or over hip injuries, or?
I think some of it is that, and I think some of it is just the fact that when we're bearing force through our weight-bearing joints, the knees just see more force than the hips do. So that wear and tear, the beatings that people take to their joints over their lifetime, their knees just seem to feel it more.
If I'm having knee pain right now, give me your 30-second spiel on directing me on what to do.
Fortunately, joint replacement is a very algorithmic approach. Our arthritis is an inflammatory condition, so we treat the inflammation. The first thing you do is anti-inflammatory medications. Usually it's over-the-counter medications. Sometimes you need prescription strength, either from an orthopedist that you see or from your primary care doctor, physical therapy, the more basic stuff. Once those are not really controlling the symptoms, don't make them go away, that's when we start doing things like injections, steroid injections, gel injections. When that doesn't work, well, at a certain point, we do have to admit that a mechanical problem does need a mechanical solution, and that's when you start talking about the orthopedic surgery.
So if I try the anti-inflammatories and I start physical therapy, how long typically should I give it to start to feel better before I say, hey, this isn't working, I may need more?
Usually it's several weeks, I would say, because a lot of the issues with the anti-inflammatories is, especially the over-the-counters, we take them when we feel pain and they last for 4 hours and then we forget to take the next dose and then we skip a dose here. Or for the physical therapy, it takes a while for those muscles to build up the strength that you need. So it can take several weeks before you're noticing much of a difference.
And do you always do radiology studies when you meet a patient?
Pretty much always start with x-rays. The main reason being is arthritis is seen on x-ray. No reason to get CAT scans or MRIs. If we see the arthritis on the x-ray, if we have the answer, then we know the answer.
Why pick St. Joseph's Hospital or Catholic Health over a multitude of other systems in the area?
So what I would say is that the thing that sets us apart is the fact that we are a true community hospital. We do still have the latest and greatest. We have robotic technology for our hip and knee replacements. We're doing anterior approach, total hips. We have an accreditation that we just got from the Joint Commission, kind of showing that the work we've been doing is up to that standard of all of these other facilities. But the thing that sets us extra is that really you're being treated like your neighbor. And the reason is because a lot of times, well, the patients are the neighbors. I actually had a patient that I did a knee replacement on yesterday who realized that the physical therapist who came to see him the next day was literally his neighbor.
To go to a large hospital, particularly in a major city like New York City, and just be one of hundreds of procedures that day, to me is not very appealing.
No, you just become a statistic. In that case, another personal story I guess I can share is I did a knee replacement on a gentleman who is a Santa figure. He does mall Santa stuff, he does parades, and when he came in for his surgery, the nurses actually decorated his room with Christmas decorations. Wow. They added that extra personal touch. They gave him milk and cookies, which I said maybe not so much. He's a diabetic, he's up on that a little bit, right. But it's still, the touch is there.
So you replaced Santa's knee, is what you're saying.
That's right.
What is it about St. Joseph's that sets it far above any other hospital, in your opinion?
Well, like I said, I think the community approach really is the biggest thing. Again, we do have the robotic technology. We're doing sort of the latest and greatest when it comes to getting people out of the same day. We do multiple different types of nerve blocks, for example, that not everyone is using, which we've noticed a huge difference in our post-operative pain control issues. People are not needing as much narcotic medication. People are routinely going home same day as surgery. No one really goes to rehab facilities anymore. We haven't found the need for any of that kind of stuff. And I do find that from some of these bigger centers, people who are either have family or friends that go there, that's sort of in their head that they're still staying in the hospital for several days, still going to rehab centers. And I think some of that is, like you said, people becoming a little bit of a statistic and not getting that individualized care.
Dr. Lepkowsky, thank you for joining us on this program. It's very informative, and we will definitely have to have you come back.
Thank you again for having me.
Coming up next, we'll learn about different area of orthopedics at Catholic Health. Foot and ankle injuries. You're watching Stronger Together with Dr. Dave.
My boyfriend drinks too much. I found help and support at Al-Anon Family Groups. Is someone's drinking troubling you? You might be surprised at what you can learn in an Al-Anon family group from people just like you. Call 1-888-4-AL-ANON or go to alanon.org.
When you come to Catholic Health Cancer Institute, we'll get to know you. Every detail, from the genetic makeup of your cancer to your other health conditions to your emotional and physical needs. Because each detail gives us another opportunity to personalize your care and improve your outcome. And all of them can add up to a life-changing difference. At Catholic Health, we know you, we know cancer, and we know your cancer.
Knight's being a family-oriented organization and also a community organization. Anything we can do to better the lives of those in need, it's an opportunity to really put your faith into action.
I'm very grateful for them. I appreciate them so much. They are always here. It's like a family.
Welcome back to Catholic Health, Stronger Together with Dr. Dave. Today, we're talking about Catholic Health's orthopedic program and the different services they provide. My next guest is Dr. Salvatore Rizzo, an orthopedic surgeon with expertise in general orthopedics and foot and ankle surgery.
The foot and ankle has 26 bones and over 30 joints. Not many of them move that much, and they're under even more stress than the bigger joints of the knee and the hip. And so what we tend to see is because there's a lot smaller joints, they take a lot more stress proportionally. And so people end up with a lot of different conditions than just simple knee arthritis, hip arthritis. There's a lot more that can go wrong, a lot more moving parts. If you think about a knee, it's like this big. An ankle is like this big. And so what we see is that the ankle can take up to 9 times your body weight with certain activities, and all in that small little section. I see a breadth of everything We certainly have the sports stuff. We certainly have the, I got into a car accident or fell off a ladder and shattered my ankle. Everyone's pretty familiar with that. What I see for people who have foot pain and ankle pain that started without an injury, almost universally have limitations in their ability to move their ankle, usually stemming from a tight calf muscle. And because of all those joints that we talked about, if the ankle, the biggest one in the foot, doesn't move as much, the other smaller joints have to take on more motion, more stress. And so over time, 10,000 steps a day, 9 times your body weight, we see that those joints wear out. Plantar fasciitis, Achilles tendonitis, foot arthritis, big toe arthritis. We see a lot of those just from a tight calf, just from abnormal walking motions, and they build up over time. That's why it usually all of a sudden it feels like it starts one day out of nowhere. I didn't fall, I didn't trip, I didn't have any of this happen, it just popped up. And I see people whose foot gets flatter or they have a high arch and everything gets really rigid. A lot of it comes down to that. It's more so long-term wear and tear that I see than the occasional sports or trauma. So let's go back to the arthritis, which is a lot of what I see for people who just have sort of foot pain that came out of nowhere. For most arthritis in the foot, it's unfortunately not like a hip or knee, which are amazing surgeries. People do really well with replacement. We've tried here and there to replace joints in the foot. They're so little that the best solution typically is a fusion, and that sounds really scary. We're taking a bone, a joint that's supposed to move, and growing the bones together so it doesn't move anymore. The people who need that procedure, the joints have gotten so arthritic that the bones don't move much anymore to begin with, and any motion causes pain. By fusing those joints and putting them in the right position, the pain goes away. A lot of times the fusion for the sort of the midfoot is the problem. Ankles can be replaced or fused. That sort of depends on who you are and how active you are, and we have a long discussion about that in the office. Ankle replacement has come a really long way. And then for the plantar fasciitis and Achilles tendonitis, a lot of people want a procedure done in the foot for that, and it makes sense. I have pain in the foot. I would attack the target, and I really would for any of these other procedures, which is the calf muscle. Almost always I will lengthen a calf muscle with any of these procedures to take away the root cause and then also address the other stuff in the foot. I change people's shoes. A lot of people have trended towards these Hokas and other running shoes that put your heel up and lift you up off the ground, which is the exact opposite of what we want to do. If you're just walking, it's putting you more on the top of your foot and stressing all the joints in your foot more so than need to be. So I take people into zero drop shoes, meaning the heel and the forefoot are at the same height, get their heel back on the ground, drive all the weight up through their leg instead of through the bending of their foot. I have them stretch, go to therapy, focus primarily on stretching their calf and working some of the muscles in their foot. And that's almost everyone gets that right off the bat. Catholic Health provides a community both on the employee side and for patients. We're all part of the one same family. And I think Catholic Health really tries to drive us to treat people as people and not as just a cog in the machine or a number, at the lunch line. So that has been really rewarding. I think patients appreciate it. I think employees like working for Catholic Health. And so that seems to just make sense to me. Foot and ankle especially is right on the forefront of a lot of the cutting edge technology and techniques that we have. So there's a lot of new techniques that we incorporate while still staying true to sort of the old time stuff. For the longest time, we treated other bone injuries with metal, and no one ever did that in the foot and ankle. And the most exciting prospect now is 3D printed implants. So let's take 2 examples. One, total ankles. For anyone coming for a total ankle with me, they get a special CT scan, and all of the guides that I use to cut through, all of the implants are personally made. They are 3D printed to the patient's anatomy. So your total ankle replacement will not be the same as mine. The cutting guides are all made to your anatomy. For a lot of these big voids in the foot and ankle problems, we can create custom 3D implants to fill the joints, to fill these holes that previously we really had no good solution for. Most of my surgeries involve approximately 6 weeks of non-weight bearing or partial weight bearing. Usually people are in their own shoes around 8 to 12 weeks. And then you can still have some on and off swelling up to a year. I'd say 90% of people's recovery is within 4 to 6 months, but it does take a little bit more time to fine tune it. I usually will not even offer anything more aggressive for 3 months. It just takes time. Some people see progress within 4 weeks, but for the general population, I'd give it at least 3 months before we really tackle anything else. Get your shoes, get your new inserts, stretch your calf, go to physical therapy, give it some time. And if we tried all that, we gave it the good faith effort that, hey, this is not going to happen without something more invasive, then and only then do we talk. I'm not usually someone to sign you up for surgery the first day, unless you have a broken bone that needs to be fixed.
Maybe you're an athlete or you have a loved one who participates in sports. You'll definitely want to watch this next segment. We'll hear from one of Catholic Health's sports medicine specialists. You're watching Stronger Together with Dr. Dave.
He helped me learn to read.
It is the best feeling in the world. They impact me. I'm proud of the work that I'm doing.
There's been dramatic results in our kindergarten classroom this year from having a foster grandparent.
On Long Island, there are families facing challenges every day, struggling to make ends meet, searching for hope. That's where Catholic Charities of Long Island comes in. We are a beacon of compassion in the name of Jesus Christ, offering support and services to all those in need. From providing hot meals to homebound seniors, shelter for the homeless, counseling for those facing despair, Catholic Charities of Long Island, with our faith, finds a way. Catholic Charities of Long Island. Join us putting our faith in action.
As farmers and ranchers, stewardship of the land comes naturally. We help keep water clean, improve the soil, and provide habitat for wildlife. But did you know that conservation can also improve your bottom line? Learn more at conservationpays.org.
Hi, I'm Susan Lucci. I never thought about heart disease until I had my own heart event. I never had a health issue, but suddenly I had that pressure, that elephant pressing on my chest. I had a 90% blockage in my main artery. I received 2 stents in my arteries. Stents developed through research funded by the American Heart Association. I'm so grateful to the American Heart Association. Their research helped save my life. Learn more at helpheart.org.
Welcome back to Catholic Health, Stronger Together with Dr. Dave. So far, we've learned different types of orthopedic issues and treatment options that are available at Catholic Health. Now we're going to take a look at one of the specialized parts of the orthopedics program at Catholic Health, sports medicine. My next guest is Dr. Jesse Riker, an orthopedic surgeon with a specialty in sports medicine. Dr. Riker, thank you for joining us.
Thank you for having me.
So you're going to be a really busy guy because you're going to have to deal with athletes, teenage athletes. You're going to have to deal with middle-aged weekend warriors like myself.
Absolutely.
And you're going to have to deal with older population. So your subspecialty in orthopedics really is sports medicine. In a few sentences, what does that mean? How are you different than a quote-unquote typical orthopedic surgeon?
So we do 5 years of regular training, so you get exposed to everything. And then I did a year down at University of Kentucky focusing on just sports-related issues. And that doesn't mean just athletes. It's really anybody that relies on the functioning of their body to make a living. Whether it's you hurt your shoulder doing construction, or you're an athlete that tore something in their knee, I'm there for everybody. And certainly anybody that wants to get back to doing something that they enjoy.
When do they reach out to somebody like you? I mean, do they have to go to an orthopedic surgeon right away? How would you advise these people?
A lot of primary care doctors and non-operative sports specialists do a great job of sort of filtering and getting you to the right person. I have no problem seeing them for the first time. I like doing the simple things. I think that a lot of people neglect kind of rehab and they sort of abuse their bodies working hard every day, and then they have pain and they just sort of ignore it.
Yeah.
If there's simple things we can do to get you out of pain so you can continue to work, or you can continue to play sports like you want to, why not try those? So I'm happy seeing you on the first time. calling me. Anything that pops, clicks, catches, locks, I'm always there.
I think it's really important that the orthopedist sees that person early on, because a lot of times they'll come in and say, look, I hurt myself, I did rehab, I'm 30% better, but what were you initially? And I think when you see that, I think it sticks in your brain how much they've improved or have not improved.
Yeah, and it also gives a good answer. Were you doing the directed things at the actual injury? Some people, they're like, I rested a little bit, and then I did PT maybe once or twice a week for a couple weeks.
Right.
It's like, then they come to me and they say, I tried all those things.
Right.
And they want, MRI, they want surgery sometimes. Yeah. And I go, we haven't really tried them. Just like a muscle takes time to build, injuries take time to heal. And if you're doing the right things and it's directed at the right injury and you're not healing, then we talk about surgery, and then we talk about the other advanced things.
How long should we give physical therapy on average before we decide, hey, maybe this is not the way to go?
So everybody's different. If you had an acute injury and you felt something pop in your shoulder, and when I'm examining you, you have significant weakness, that changes things. I'm thinking more that you may have an injury that may not do well with PT.
Not your usual popping. People pop their joints all the time. I see this, right?
That's fine.
Okay.
Clicking
is okay.
Non-painful clicking, I go, that's fine, ignore that.
Okay.
Forget about that. If it doesn't hurt, it's okay.
Okay.
But yeah, if people have big injuries, I'd hope they come to me first before going to their primary care, because I'm going to get an MRI, and that may be something that needs to be repaired. ACL is torn. You get big swelling in the knee, you get a pop in the knee. That's a surgical thing.
Got it. Okay, that makes sense. So I come into your office, shoulder pain, it hurts. Are you doing a radiology study on me right away?
Generally, yeah.
What
so
type?
If you had some sort of injury, we have X-ray available right in our office. I like to pull it up. I show you everything on the computer. I walk you through your X-ray. Then I do your exam, and then I kind of correlate. Wow. Usually these people, it's more soft tissue injuries. But occasionally we have some fractures that come into clinic and we get an X-ray and they're like, I've been trying to rehab this and it's actually broken. It's like, yes, I need you to stop doing PT. We're going to mobilize you now. We're going to let the fracture heal and then we'll go into PT.
Are you located at St. Joseph's Hospital?
So I have privilege at St. Joseph's. Okay. I mostly operate out of Good Samaritan Hospital.
Okay.
And then I have offices in Melville and Bayshore.
If somebody comes in, they come into your office, outpatient office, for the first time, you are able to do an X-ray of their joint, whatever's bothering them, right then and there.
Oh yeah, we have excellent X-ray techs there, and they have all of our protocols, so everyone gets different films. We get standing for the knees to evaluate all that, and then I get 4 views of the shoulder.
Do you work with physical therapists there, or do you refer them to the physical therapists that you trust locally?
So it's actually very nice within the Catholic health system. I've met all the physical therapists. I go to the different facilities to check them out, so I know which one has like a pitching coach, which one has somebody that is very focused on volleyball and shoulder pathology, because each of these are different. And I like to find people that are also passionate about, if they're very into playing baseball, they'll study how a thrower's arm needs to be rehabbed. So I'll sort of push them in different directions depending on what their injuries are. Wow. And then I get reports back, which is good too. I get to check in without actually speaking to them. You can do the most beautiful surgery, but if somebody doesn't start moving their knee, if somebody isn't doing the right thing after surgery, then you may not have the same outcome. And the issues come when people come back too early, or they didn't do the proper rehab and they're not strong enough to come back when they should, and they could risk re-injuring it. And now you're dealing with another surgery.
Right.
So it's important to have people I trust that are rehabbing and people that care that are rehabbing.
To me, the best surgeons are as likely to say you don't need surgery right now as they are to say do the surgery.
Yes.
Because they're experienced, they know what happens if you don't make the right decision.
Yeah. Right. And I tell patients, I like the right surgery for the right patient at the right time.
Right.
Those things need to align.
Right.
And also, I like the simple things. The simple things consistently have been working, and a lot of people get better with those.
Yes.
So if we haven't tried the simple things, I'm not jumping to the most advanced stuff.
I get the sense that you really do tailor your treatment and approach to that individual patient. You're not going to treat a 15-year-old being recruited for college basketball the same way you're going to treat somebody like me who plays tennis on the weekends, right?
So yes and no. I think I envy like our trauma colleagues in orthopedics. It's like, yes, you broke your femur. We're fixing that. It's easy.
Yeah.
Everybody comes in with a meniscus tear, and yes, if you're a young, competitive athlete, there are different things that will go into that meniscus tear than if maybe you're older and you're just looking to be able to be pain-free and go to work.
Right.
When you talk about meniscus repairs versus just kind of shaving down that tear, that all goes into play. And then You will get the same treatment as far as if you tore your ACL, or I saw a young competitive collegiate player tear their ACL. It will be the same roughly surgery. So you get the same treatment, just kind of a different discussion beforehand.
When would you recommend a replacement over a repair?
So for the shoulder, it's a little tough. When looking at the rotator cuff, you rely on that to move your arm through most ranges of motion. If you're much older and you have a traumatic injury where your rotator cuff tears off, the tissue isn't the same. It's not the same as when you were 30 or 40. So you do talk about sometimes doing a replacement in those situations, a reverse total shoulder that doesn't need your rotator cuff to give you function and pain relief.
Right.
If you're younger, absolutely. I always try and preserve your normal anatomy.
Right.
I'd like your shoulder to work like it did before your injury. And I think repair will give you the best chance at that. But there are certain situations where, yes, you kind of need to go to a replacement of the shoulder.
The replacements in general are different now than they were 10, 15 years ago?
Yeah, everything gets better.
Yeah.
Technology improves, you know, instruments are improving. They have 3D guided cut guides now, so it's patient specific. They scan and make cut decisions off of your anatomic bone.
Wow.
And the plastic pieces that they use as sort of buffers in these joints are getting better. So they last longer and longer. The hope is that we do one surgery and that we can get up to 25 to 30 years out of life of the surgery, especially reverses. Typically those are lower demand patients. They're not putting the same stress and strain on their shoulder. And that would be like a one-time surgery, whether in your 60s or 70s, and hopefully will carry you without pain.
So the message this entire discussion has been really individualized care. You know, everybody's different.
Yeah.
It's not cookie cutter. And you really need, people watching this show have to understand, you need to meet with somebody and who's going to shepherd you through this process from the beginning until the end. Not just to do a surgery and then forget about you, but really to know, you know, what are the steps we're going to use before surgery, and then if we need to do surgery, exactly what type of surgery. So it's very individualized, and that's encouraging to me as a cardiologist looking at an orthopedic surgeon. It's encouraging that everything is so individualized and getting better and better.
Yeah, absolutely. I make protocols for all my surgeries and rehabs, and some of them are a 9-month protocol. And then after the surgery, I'll sit down with them and I'll start crossing things and writing new things because your surgery was different than the last patient's.
Right.
So we have broad goals that we want to meet. I want you to still be able to do that. Right. How can we get around that so you're not hurting while you're doing that?
Makes perfect sense. This is really informative. You definitely have to come back on the show. I'd love to hear the latest and greatest in the future. But thank you for taking time out of your very busy schedule.
Oh, thank you. This was great.
Thank you to all our guests today for sharing more about Catholic Health's orthopedic program. If you would like to know more about Catholic Health or to make a gift in support of one of the amazing programs you heard about today, please visit CatholicHealthLI.org or call 1-855-CHS-4500. Thank you for watching today. I'm Dr. Dave Degatti, and I'll see you next time on Catholic Health, Stronger Together with Dr. Dave.